So yeah, personal history is bowel, bladder, sleep and appetite. Appetite is whether the person is able to eat properly, eat adequately or not. Okay. Now next, coming to addiction history. In addiction history, if you're getting a positive addiction history, two things you need to ask. One is frequency, another is duration. And two major addiction histories that are important for your final year cases are smoking and alcohol. These two. So when you're getting a smoking history positive, someone is saying that. So suppose you're getting a smoking history positive, someone is saying that he smokes cigarette. The next thing that you ask is frequency. Frequency means how many cigarettes per day, and then duration. Duration means for how many years have you been smoking. Why is it important? Smoking history in respiratory diseases, especially in COPD, where there is irreversible changes in the airways. For that COPD, if a person has a smoking history of 10 cigarettes per day for 10 years, we also may refer to it as 10 pack years, then the chances of COPD goes up. Next is alcohol. You'll be getting patients of pancreatitis. Chronic alcoholism is one of the major risk factors for pancreatitis. Then you'll get patients of liver diseases, liver cirrhosis. Alcohol is a risk factor. For that, when you get a history of alcoholism, the next thing that you ask is frequency, means how many times do you drink in a day, or how many pegs do you drink in a day, how much alcohol do you consume in a day, and duration, for how many years have you been drinking. Okay. Now all those pancreatitis patients whose etiology is chronic alcoholism, most might tell you that we occasionally drink. Okay, everyone says that whenever someone is saying about alcohol history, they'll say that they do it occasionally, but no occasional drinking will lead to pancreatitis. So you just tell the patient कि आप सच बताओ, नहीं तो आपको treatment नहीं होगा. Then the patient will tell you that he drinks so much in a day. Okay. Now next, coming to family history. Family history means now in family history we need to see about blood relation and first degree relatives. Now we don't need to see the family history of some brother-in-law, sister-in-law, father-in-law. No, that's not related to this particular person. Only first degree relatives and blood relation. Family history is important. Why? There are so many diseases that are transferred genetically. For example, diabetes, hypertension. Diabetes, hypertension, all these things. So now suppose someone breast cancer, for example, if mother is positive for breast cancer, we also do the screening for the daughter. So that is why family history is important. And apart then, treatment history. Now treatment history, so we already covered in past illness, like if someone has received any treatment for a disease, then we mention it over here, treatment history. Then drug and allergy history. If the patient has any allergic symptoms to any particular drug or any food, we need to see it. One of the major allergic reactions that we are concerned about is anaphylaxis. If someone had a reaction like that in the past, then that before giving antibiotics too, we always do our skin test after proper APST, that is after proper skin test, to see that it doesn't have any reactions like that. And last is psychiatry history. Not that important here, but since it's mentioned in some books, I'm mentioning here. Psychiatry or psychological history is that you take a history about the mood of the patient, the way the patient is behaving to you. So more or less these are the points that are needed to be covered in history taking. This will give you a particular idea about which system we are going to examine, or which way we are focusing our diagnosis on. After this, there is general survey or general examination and specific systemic examination that I'll cover in separate videos. But history taking, these were the points. Hope you understood, and if you have any doubts, leave it down in the comments below. I'll try to answer most of your questions. Thank you.